Since it was founded over 60 years ago, the National Health Service has been a key public service benefiting the lives of millions. Recently, NHS organisations across the South East Midlands, in Bedfordshire, Luton, Milton Keynes and Northamptonshire, began working together in order to best share their network of resources for a growing population.
I'm encouraged that the major general district hospitals at Kettering, Bedford, Luton, Milton Keynes and Northampton, with the GPs, have come together to really look at how they deliver NHS services. So you've got the major players coming together to look at what they're doing and why they are doing it.
Our aim, as ever, is to continue improving the quality, safety and affordability of the health services you receive for the long-term future. To do this, we're looking at where to provide some types of services more locally across the region, and also providing more specialist centres of excellence in particular areas.
There's a lot of evidence that a lot of patients, although they get great care, it's not necessarily in the right place. For example, a lot of people end up travelling to hospitals when in fact that care could actually take place within the community. There's also a body of evidence that shows that where you have specialist centres for care, they can actually provide a better quality of service, for example, strokes.
To best decide how these services should be developed and where they should be based, the NHS in South East Midlands recently launched a new review called Healthier Together. We'd like you to consider the issues raised with us so that we can provide the best possible services for you and future generations. The first area to look at is services closer to home. This means providing as many other services at a local level as we can, whether in hospitals, GP surgeries or health centres.
We already, for instance, do some outpatient clinics in GP surgeries and health centres where we provide the adequate equipment for investigating and treating common and minor ENT conditions without you having to visit hospital at all.
And the important thing for local services within vascular surgery is that patients at all of the hospital sites within the South East Midlands area will be able to see a vascular specialist at their local hospital. Any further complicated treatment will be done at the centre.
Midwifery care is probably one of the better examples of how we can provide care closer to home. Women would be able to access midwifery services locally. Then only those cases that would need more specialist care would then have to travel to the centres.
Once the specialist part of treatment is over, then people can be seen in their local hospital, maybe even their GP surgery. So travelling to larger centres shouldn't be necessary once the initial treatment is over.
The next area to look at is specialist centres of excellence. That means having some types of healthcare delivered by highly specialised health professionals in larger volumes through a smaller number of specialised centres.
It's recognised that for most types of cancer, the outcomes are better if you see specialists who are used to dealing with those types of cancer and they know the relevant treatments and they're up to date with the relevant treatments.
The problems that we see in pregnancy are becoming more complex with greater numbers of women who need specialist treatment. And not only are we looking to deliver accessible care throughout the South and East Midlands, but there will be opportunities to develop specialist centres within our area which can deal with problems much more effectively and safely than we perhaps can do at the moment.
I'm a vascular surgeon and the patients coming forward for surgery are getting older. It's much more important for us to assess their risk for surgery, and only if we do that properly will we get the best outcomes possible. There's very good evidence now that if we do more of a complex procedure, that we'll get better outcomes, and that's one of the big drivers for the change in vascular surgery.
The NHS is facing a number of challenges. Whilst we're experiencing a rise in both birth rates and life expectancy, we're also seeing an increase in more long-term medical conditions, often affected by unhealthy lifestyles. The result is a growing demand for services, coupled with rising costs for cutting-edge equipment, treatments, and staff training. Our plans will help meet these challenges and prepare us for the long-term future.
Patients are expecting much more. The specialists are expecting to deliver much higher quality services. With that, we have the responsibility of getting good value for money where money is tight, and it's tight in the NHS as it is in every other industry.
The Acute Services Review gives the opportunity of like-minded surgeons in general surgery, in orthopaedics, etc., to get together. A large group of them can subspecialise further. That drives the future of surgery. It will mean more effective and efficient surgery for patients, with the huge advantages of minimally invasive surgery done through telescopes, and you can go home immediately afterwards. Although the costs of the equipment are high, the overall benefit, firstly obviously to the patient, but also to the health service system, is a much needed reduction in beds and therefore costs.
The challenges facing my speciality are challenges of manpower, and in particular the availability of doctors and nurses to staff departments on many different sites. That means that some departments will have to centralise onto fewer sites. Some patients may have to travel further for their surgery, but in nearly all cases we'll be able to provide outpatient treatment and follow-up at hospitals closer to their home.
It's clear that to manage the challenges we face, we need to make some innovative changes. We believe that by working together across the South East Midlands, these new approaches will not only improve the quality of the healthcare you receive and bring services closer to people's homes, they will also make services more efficient so that we can do more with the money we have and build a sustainable healthcare system for the future.